Dear great people, welcome back here. It's been a minute. How's it going? I hope you're staying warm. This is another episode with Ola, Becoming with Ola, and we have a breaking news. Are you ready for this? So today, hello everyone, and welcome back to the channel. Today, I'm going to bring you an important update directly from Immigration, Refugee, and Citizenship Canada. This announcement has the potential of increasing capacity, of giving hope, strengthening support, and ultimately saving lives for everyone who relies on Canada's healthcare system. It speaks to a future where more people can access timely medical care through a stronger and stable workforce. Today, December 8, 2025, the Government of Canada has introduced a targeted measure that is designed to make it easier for more of intentional efforts to have internationally trained doctors to become permanent residents and to help to continue to economically drive progress, to continue to serve communities across the country. And this is part of a national effort to fill the critical labor gap that the government has been making substantial and intentional efforts to close, because there is a huge gap between access to healthcare support and the patients that is also waiting to receive that care. So like I said, this is a part of the Canada's government's national effort to fill these critical labor gaps and to strengthen the health workforce. The millions of Canadians, foreign nationals and residents, even visitors, can depend on every single day. And one of the major highlights of this significant changes and updates is that 5,000 slots typically reserved for provinces and territories to nominate licensed doctors who already have job offers in Canada, So there are some people currently, these are the people that this new announcement has the potential to benefit, and by large benefits the entire economic system and access to healthcare. So for me, it is evidence that once the physician, is nominated by the province that is requesting them to come and become permanently established, the work permits processing now will be expedited to within 14 days. So which helps them to keep working, while they wait for their permanent residency. Isn't that a good news? For me, I think it is, because when you look at the benefits that this would bring to the entire populace, it is very important to look at it on a cost-benefit approach. Another key measure of this is the introduction of a dedicated express entry category that will begin issuing invitations in early 2026. So this is a way to wrap up the very busy, unstable, challenging year. This category will be open to international doctors who have at least 1 year of the Canadian work experience in an eligible medical occupation. Listen, eligible medical occupation. The thing is, many of these doctors are already here. They're already caring for patients. They're already supporting the healthcare system on temporary permits, either a spouse or maybe an international student or the work permit applicants themselves, right? So this is a great way to also let them know that we see you, we appreciate you, we want you to stay, right? So this new pathway would give them that straightforward, stable, and the peace of mind they need to know that their efforts has not gone to vain. Now, the next segment, the next video you're going to be watching is the direct video from the minister. But before we continue to that, I'll let you also know that at the end of the day, when you weigh this situation, this announcement on a cost benefits approach, like I said earlier on, you can see that they already have a measure in place before under the International Talent Attraction Strategy, right? To bring in the highly skilled global talents, increase the number, of medical professionals who can practice, who can help reduce and close the gap between healthcare access shortages. Somebody like me too, sometimes I go to the hospital and you have to stay there for so long. And even when you come back, the medical practitioner is in a hurry, to send you away. I recall one time when I was I needed to see a doctor, and I waited for 3 hours only for me to get to see the doctor. And I was trying to explain. The doctor was really so much in a hurry to let me go. And I was like, but I just got in here. It was like he still has a lot of, you know, piles of files to attend to. For me, it was a turn up, but at the end of the day, when you look at what they're trying to say, like the burden on the current human capacity is so huge that this is the best intervention that I think the government has to put in place to also help to keep the people that are working every day to also be encouraged, and so that the rate of turnover, even with the short with the limited staff strength, would not increase. So, like I said, the measure is to support Canada international talent attraction strategy to bring in highly skilled global talent, increase the number of practice ready physicians. That is, physicians that are ready to practice. It helps to reduce the shortage of staff and make sure that everywhere, the provinces, the territories across Canada, can receive timely and quality medical care. So these are what our national leaders are saying is the best approach to help in building a Canada as a country that is more healthy and resilient. Guys, do you think this is the right approach? Before you conclude, let us take a short trip to listen to what the minister has said this morning when she was making the official announcement. I think it is best for us to hear from the horse's mouth. And let me know what you think in the comment section. Do you think this is the best way to take and embark on attracting the highly skilled best talent from another country into Canada? If you agree, let us know. If you do not agree, still let us know. Okay? Thank you. I would like you to watch the announcements from the minister that happened earlier today, and let us know what you think. If truly attracting experienced medical practitioners from other countries is the best way, or we can actually train from within. Let us know what you think.
And we know that for Canada's healthcare system, the last several years, particularly since COVID, things have not been easy. It means that as we return to sustainable levels, we must simultaneously attract the high-skilled talent that will help relieve those pressures, particularly in key sectors like healthcare. We've heard a clear message from patients, provinces, and the medical community. We need more hands on deck. There are qualified doctors, many here in Canada, on temporary status, and some abroad, who are eager to serve Canadians. Yet too often they face barriers, delays, and uncertainty. So today I'm pleased to announce a suite of new measures to recruit the doctors we need, to retain the ones we have, and to cut processing times to ensure it all gets done quickly. We know Canada needs more doctors. Provinces and territories are best placed to determine where their pressures are greatest. So we are reserving 5,000 federal admission spaces for provinces and territories to nominate licensed doctors who hold job offers. These are dedicated spaces over and above the annual allocations. So when a province or territory finds a qualified doctor, federal caps will not be a barrier. We are launching a new express entry category specifically for international doctors with at least 1 year of Canadian work experience in the present years. Today's announcement will open the door for eligible doctors who are already here to create or update their express entry profile now before we start sending invitations to apply in 2026.
This is where we'll be drawing the curtain from bringing to you a short clip of what updates you should be expecting for 2026. Be PR ready, try to get all your documents ready, and I hope you do the right thing. No misrepresentation. This video is for educational purpose. Thanks for watching and have a good one.